10 a.m. and I call this meeting of the Oversight Committee to order. Will the Secretary please take attendance of the Oversight Committee?
Mr. Angelou?
Here.
Mr. Guerin?
Here.
Mr. Holmes? Mr. Margot?
Here.
Mr. Montgomery? Dr. Mulrow? Mr. Rice?
Here.
Dr. Rice and Dr. Rosenfeld.
Here.
We have a quorum. The Chair will now entertain a motion to excuse the absences of Mr. Holmes, Mr. Montgomery, and Ms. Mulrow.
So moved.
We have a motion and have a second. All in favor vote aye.
Aye.
Any opposed? The motion carries. Our next agenda item is public comment. As we all know so well, CPRIT was created by Texans to serve people of Texas, and public comment is a very important part of our gatherings, and we appreciate when citizens do take the time to come and share their insights and their opinions and their personal experiences with us. Do we have any requests for public comment?
No, sir.
Hearing none, then we'll move to the next agenda item. In the agenda, we had shown that CPRIT grantee Dr. Yankelov was going to be with us today. Unfortunately, he's ill and unable to attend, and we're working to reschedule him for the November meeting. The Chair now recognizes Mr. Roberts to provide the Chief Executive Officer's report.
Thank you, Mr. Guerin. As indicated in the brief memo in your meeting books, I do have a couple of items to call to your attention. I'd like to report that we are close, I believe, in being able to fill the communications specialist position that was vacated a month and a half or so ago. I hope to be able to report positively on that sometime in the next week or so. You will recall that at the last meeting I reported on the first two of three American Cancer Society Cancer Action Networks events that had occurred in Austin and in Houston. After the August meeting, we did have one, or there was one held in Dallas on August the 30th. Presiding Officer Guerin and Dr. Rosenfeld and Dr. Wilson and I were able to attend that, and it was the third outstanding program. At that meeting, the Bridge Breast Network, representing prevention, presented, as well as a patient, a client of theirs who gave a very moving testimonial to the benefits that she had received from the bridge. Dr. Josh Mendel, a CPRIT scholar from Southwestern Medical Center, gave a summary of the work that he's doing. Tom Kowalski of the Texas Healthcare and Biosciences Institute presented on the economic benefits of CPRIT. And then Representative Jason Villalba spoke in support of CPRIT activities, but he also gave quite a moving testimonial as to his interest in cancer and support for the agency. I cannot express my appreciation strongly enough to Cam Scott, the American Cancer Society's Cancer Action Network, for holding these. As you will recall, these were organized, scheduled, and the purpose of the meeting was done completely unbeknownst to any of us. Fortunately, I was able to attend all three, and they were absolutely wonderful events. The next item, I'm going to jump down to the TribFest panel. I've mentioned this previously, but on Saturday, September the 24th, at the big Texas Tribune Festival that's now a yearly event here in Austin, a really big gathering of various political and social issues gets discussed in this better part of 2 days confab. And at 8:30 on Saturday morning, our Dr. Wilson will be on a panel concerning cancer along with Lance Armstrong, Dr. Ron DePino, the president of MD Anderson, and Representative Sarah Davis from Houston will also be on the panel, which will be moderated by Jake Silverstein. That name may be familiar to some of you. He's got a long history with Texas Monthly. I believe he was editor there. He's now editor-in-chief of the New York Times Magazine. We considered it to be an honor to have CPRIT represented at this event, something that we have coveted for the last several years, and really look forward to getting some good messages out. On October the 5th, several of us are going over to College Station to meet with a variety of administrator and research staff on prevention and academic research activities with an eye of stimulating greater interest among the many components of the Texas A&M University system. And look forward to that. We will be meeting, as I said, with various administrators, but Chancellor Sharp and his top-level staff will also be involved, at least partially, in those discussions. Then at 4 o'clock this afternoon, this is not in the memo, we will be presenting our request for legislative appropriations to staff of the Legislative Budget Board and the Governor's Office Budget Division. This is a normal part of the budgetary process. It is a formal meeting where we will present our request. They will ask us various questions concerning the request, but it is our first opportunity to get on the record our request for funding. As you will recall, it's very similar to what we've requested in the past. It will be for full authority for the $300 million a year bond, the bonds that the Constitution authorizes for us. Then the last item, if you'll turn the page to the sheet that you're quite familiar with by this time, the Heidi's green and gold table for this fiscal year. Since we will be discussing potential awards in a few minutes, I'd like to assure you that we do have sufficient funds available for the ones that the PIC is recommending that you fund. But I think that it is important to note that $50 million, which is, if it is approved, represents 26% of the amount of academic research funds that we are soft budgeting as being available for this upcoming fiscal year. This is a large amount of awards that are coming forward to us, but I think when Dr. Wilson reviews them, you will be quite excited as to both core facility and recruitment awards that we have for your consideration. With that, Mr. Guerin, that concludes my comments. I'll be happy to respond to any questions.
I'd like to add to your expression of appreciation to Cam Scott and the American Cancer Network for pulling together these forums around the state. And you noted the cancer survivor's story that she shared with us, but we talk in terms of millions and tens of millions of dollars in large institutions and large organizations, and it's so important to be reminded often of the real personal impact that the work of CPRIT has on the lives of Texans, and the testimonial that woman gave about the services she received from the Bridge Breast Network as a result of the CPRIT grant really brought home the life-changing, life-saving work of CPRIT. And I really thank Cam Scott and his team for pulling that together and giving us that reminder of the importance of this work. Are there any questions for Mr. Roberts? Thank you for your report. The chair now recognizes Dr. Wilson to present the Program Integration Committee's grant award recommendations for academic research awards.
Thank you, Mr. Guerin, and good morning, committee members. A special thanks to you for convening today's meeting for these important and time-sensitive research program recommendations for your consideration. We are going to be discussing 14 research awards that are in response to 4 RFAs issued. The first is for competitive renewal of core facility support awards that are in existence as CPRIT supported core facilities that are scheduled to end this fall. So these are continuation of renewals. And then 3 recruitment RFAs for established investigators, rising star, and first-time tenure-track faculty members. As Mr. Roberts mentioned, the total recommended award considerations are a little over $50 million. All 14 of these awards respond to a priority to enhance Texas research capacity and life science infrastructure, and 4 have specific program priority response, 1 to prevention and early detection, 1 to cancers of importance to Texas, and 2 to computational biology areas of emphasis, and I'll point those out as we go through the individual slates. To begin, I'm going to consider the 4 award recommendations for in response to the Core Facility Support Award competitive renewals or competing renewals. These are, as I mentioned, existing core facilities that have been supported since 2012 by CPRIT, and they will end their current funding period in the fall of this year. The panels that reviewed these core facilities considered not only their response to cancer research support, but also expected them to be high performing and have substantial impact during the past funding period. And I'll go over, as I discuss each one, sort of benchmarks of success that the panels considered. The first is application 170005 to Baylor College of Medicine, a proteomics and metabolomics core facility led by Dean Edwards. This core facility supports a workhorse of cancer research today to provide the analytical capabilities for protein and metabolism research. And as noted in the brief summary that I provided, during the past grant period supported 67 funded cancer researchers and supported the ability to compete for almost $50 million of external peer-reviewed funding. So again, the kind of impact that these core facilities were being expected to provide. They are, this particular facility is recommended for 5 years at $5 million over that period of time. The second facility is 170003 from Texas Tech University Health Science Center, the North Texas Clinical Pharmacology Cancer Core led by Richard Leff. This core is a very interesting partnership between North Texas cancer investigators, very high amount of interaction with the UT Southwestern Simmons Comprehensive Cancer Center in support of early phase clinical trials, particularly phase 1 trials, where the pharmacology core, taking expertise from the School of Pharmacy, not existing in any of the other academic components in North Texas, provides the ability to analyze the impact of the drug and its metabolites. Very important for understanding success as well as toxicity associated with early phase trials. As noted, 36 NCI-funded projects were supported by this core facility. Again, evidence of its impact during the past grant period. The next is 170002, a core facility support for next generation sequencing facility at UT MD Anderson Science Park facility in Smithville. This facility is again a workhorse of cancer research, providing the capabilities of analyzing the DNA sequencing in normal and in cancer models. And again, has had significant impact not only in Smithville but also at UT Austin and Texas State, where clients had used the facilities. A total of 28 faculty have benefited from this facility. And the last is 170006 from Baylor Scott and White Healthcare, a core facility that supports new drug production. And I'll take a minute to brief you on this facility because it is unique in Texas. About a decade ago, Scott and White invested in the establishment of essentially the clean rooms necessary for creating the antibodies and proteins associated today with many of our new precision cancer therapies. And this facility has been supported for the last several years by CPRIT and has a track record over this the past decade of creating 9 new potential cancer therapeutics, several of which are currently in clinical study. And it will be, the recommendation is for 3 years of funding at $3.5 million to allow them to expand the capability of their core facility from 2 clean rooms to 3, which would enable their support of additional faculty projects from across Texas. I'll stop at this point and take questions if you have for these 4 core facilities.
Dr. Rice.
Thank you. I was just going to ask a question and maybe make a short comment. I love to see that various of these core facilities support awards use those resources across facilities, so it's not just one facility. And you know, the example was the North Texas and several of them. So wondered do we encourage that formally, or is that just the natural history of how these kinds of things happen? Just thinking about, again, the idea that a core facility investment could be used not just for one facility, but for multiple facilities.
Yes, so both in the RFA as well as in the review process, the impact of the core facility, one measure is whether or not it's actually leveraging the opportunities both from the institution as well as across Texas. And as you may recall, several of the core facilities we considered last month indeed bring together complementary expertise across multiple facilities in just the way that you mentioned.
Thank you. I was just going to note, you know, Temple, Smithville, Lubbock, major investments in those areas is a great thing. So we appreciate the work there.
Yeah.
Thanks, Dr. Rice. Questions from any other members? Dr. Rosenfeld.
Thank you. Jim, good to see you again.
Hi.
I have a couple questions about some of the specific programs and a question about the general idea of renewals for these programs. Mm-hmm. On the renewal end, it seems like what you said is these programs have been in existence. They bring in tens or hundreds of millions of dollars of NIH research money. The question is, since CPRIT helped establish these programs, doesn't their business plan allow for them to be self-supporting at this time? Is one question. Mm-hmm. And the other is, does the continued renewals mean that when CPRIT stops giving money, these places are going to fold and go away and flush CPRIT's investments?
Yeah. So to the first point is that these core facilities are not self self-sustaining in the sense that the infrastructure involved, the investment in technology and in the educational aspect to bring investigators up to speed on new technology is changing every year, as you appreciate. And so the core facilities have to invest in upgrading those technologies. Before CPRIT, that was a requirement of institutional resources that came from various places. And what CPRIT has done is to enhance those and to develop shared resources that just didn't exist before, or to expand their capability. To the point of renewals, these facilities will need to continue to be reinvested in to sustain, and many are retired when the technologies go away or replaced by easily taken over by industry or the like. And what these represent are cutting-edge resources that, as I mentioned, are continually to reinventing themselves.
But does the business plan for these programs allow for them to eventually become self-sufficient? And one of the reasons I ask this, as you said, they bring in tens or hundreds of millions of dollars of NIH funds. And probably for the NIH funds, the overhead for the fund is what, 50% or 100%? You would know better than I. Mm-hmm. So you would think with all this overhead money coming in, and with CPRIT's investment to add expertise and add capabilities, that they should certainly be self-sufficient at this time and should not have to come back to CPRIT for continued funding.
Yeah. So respectfully, that's just not the case. As I mentioned, all of these facilities are continually reinventing their capabilities. They're not offering yesterday's technology. They're actually bringing new facilities and new capabilities online. That requires tens of millions of dollars of reinvestment and cannot be supported by user fees, which the business plans of these facilities are much bigger than the CPRIT award, because that's the user fee, if you will, the sort of direct cost rather than the infrastructure cost. So the funds that are awarded from the NIH to support the investigators are actually paying for the services on a essentially contractual basis. What they're not asked to pay for is the infrastructure support and the personnel expertise that would far exceed what the NIH and other funding agencies are able to support. And in fact, what's really superb about these investments is it's bringing to Texas cutting-edge infrastructure that we just wouldn't have despite the funding from NIH, et cetera, to move forward. So I'm not suggesting that in any of these business plans should we expect these facilities to be able to continue reinvent their capabilities that would exceed the practicality of the funding mechanisms.
So their business plan essentially says that when CPRIT stops funding, that they will not be self-supporting and they will disappear.
No, not at all. When and if CPRIT stops funding, there will be opportunities to use institutional and other support. And again, this is, I think, an important point that that I would like to make with regard to these core facilities. None of these are providing sort of routine technology support. These are all cutting-edge activities that have to continue for modern cancer biology research. So it will be critical for the institutions involved to figure out how to continue their mission.
Let me just ask you one more question to try to put this into perspective. If CPRIT did not fund these renewals, would these labs continue?
They would be severely truncated.
So why doesn't the so the institutions, these are $3 or $4 or $5 million, and these are very wealthy institutions. Why doesn't the institutions themselves support these
Well,
great
they do.
facilities?
But they do. My experience at Southwestern was that the investment in the institutional shared resources was the prize of the institution, and they are providing millions and millions of dollars of support to both support the facilities as well as to create the new facilities. For example, we're going to be talking in a few minutes about two extraordinary individuals who you will be considering as CPRIT scholars. They're interested because of institutional investments in an area called cryo-electron microscopy. UT Southwestern, just in the past 2 years, has invested $17.5 million in the capability of cryo-EM. Cryo-EM is, as I'll explain in a few minutes, the critical component for moving forward our discovery of precision medicine targets. And CPRIT is not supporting that $17.5 million, but CPRIT is actually going to contribute to those shared resources by the expertise that's being recruited. And time and again, there are examples that are similar. So I don't think that we can suggest that the institutions are relying solely on CPRIT, but what CPRIT's doing is helping us to elevate the capabilities in Texas and to provide that elevation both for our current faculty, but also recruiting the next generation to bring these technologies of importance.
Okay, thank you. I just think that I have a problem with the with the renewals, and that after the initial funding, it seems like they should have a business plan that allows these facilities to exist on their own. But I want to go on. I don't want to monopolize all the time. Just want to ask specific questions about two of the programs.
Sure.
The first one is the core facility at Texas Tech. And this is 17003.
Yeah.
And just one quick question. Is this a GLP facility?
It is not. This is a core facility to provide the drug levels and drug metabolites and similar biomarkers associated with clinical trials, but it is CLIA certified, so that it would qualify for FDA supported phase 1 trials.
So if someone did a study and uses facilities to monitor their blood levels or biomarkers or whatever, that data cannot be used in an FDA submission for a new drug approval.
No, it is CLIA certified.
It's CLIA.
GLP, I thought you were referring to drug
good laboratory practices.
Laboratory practices for drug creation, but it's CLIA certified, which is by definition what's required for the FDA submissions.
Okay. And one other sentence you have in here is that these services are available to all cancer researchers in North Texas. Mm-hmm. Does that mean only academic researchers?
This is a facility that is specifically supporting partnerships with phase 1 trials, so that it does not restrict it to to academic institutions. So Baylor University Hospital, for example, which has a phase 1 program with Texas Oncology, would be eligible, and in fact have been previous partners in that with Texas Tech.
So if there was a private company who wanted to have drug levels measured, this facility would be able to do that? And the reason I ask that, obviously, is because one of CPRIT's other big programs is to grow the business, the life science infrastructure. And so it would seem like if we're paying for a facility to measure drug levels, it should be available for private companies. And so I just have to ask you, is this facility provide drug levels for private companies, yes or no?
The answer is not to my knowledge, so no. And in fact, it's not a requirement of the Core Facility Support Award to have access for private industry. On the other hand, it's not discouraged. And in fact, I'm just not aware of examples in the Texas Tech facility for supporting industry trials. But I will say that most, as I think you appreciate, trials that are at the phase 1 level in both academic institutions as well as those at other sites are supported by industry, and those industry partnerships are very much part of the interaction with academic and other centers in terms of moving forward the drug discovery process. And so there is a tremendous amount of interaction with industry. What I do not know, and I do not believe is in their work plan, is a specific aspect for contracting with industry. I just don't have evidence of that.
I think we should definitely put it in there to support our growing life science infrastructure.
Yeah.
Let me move on to the other one because I just want to ask a couple questions and then not monopolize the time. This has to do with 17006. And it just has to do with maybe some optics in that it seems, my recollection can be wrong, I've done a lot of traveling lately, that the support for facilities, core facilities, has been to support academic institutions. In this case, this core facility is being asked to support a private company. And as such, supporting a private company, should this be going through the academic route, or should it be coming through the company route? It just seems like it's supporting a specific facility at a private hospital, and not that there's anything wrong with that, but if I'm the hospital down the street, I'm going to say, wow, CPRIT gave money to this hospital, I'm going to want some money, and I'm going to have it fund my laboratory. It just seems like there's been a switch from just supporting academic institutions to now supporting a private facility.
Well, I couldn't disagree with you more. The Cancer Research Institute at Baylor Scott & White is an academic discovery entity. Its commitment is to research and discovery. It happens to be underwritten by a foundation and a hospital system, and it is exactly what we're looking for. It's a very novel facility that was started, as I mentioned, a decade or so ago with a tremendous amount of investment in the discovery research part. And as I mentioned, this facility is supporting academic investigators at Baylor, at Texas Health Science Center Houston, at Baylor University Hospital in Dallas, in quite unique studies of targeted antibodies that would not have been developed without this facility involved. So I just actually don't get your point.
Well, every hospital has a foundation. So every hospital could go tell its foundation, hey, go get some CPRIT money. I just think there's a switch here. I don't know if it's a good switch or a bad switch, but it's something I haven't seen before.
Well, I must respectfully go back to what I said. This is not a hospital. This is a Cancer Research Institute that is supported by a hospital. We have many examples of very robust institutes in Texas that have been supported by CPRIT. Houston Methodist Hospital, for example, Research Institute. Baylor University Hospital Research Institute in Dallas. And there's some that I'm sure that I haven't mentioned here. So this has been part of the CPRIT portfolio, and a very robust one that we quite candidly want to encourage.
Thank you. Jim, I really appreciate your comments.
Dr. Rice.
I was just going to echo, I guess all those that you listed, Jim, are academic research institutions, whether or not they're owned by the state or owned by Rice University. I think, is that your point, that those are all academic research institutions and they're not for-profit companies?
Thank you.
Is that right?
I think that's true, but they're not academic institutions in the sense of educational institutions, but they are research institutes that are nonprofit and associated with quite significant hospital systems. And I think we all would welcome the investment of the health the health centers in establishing similar institutes across Texas.
And they are all eligible to apply. This one's not singled out. They are all eligible.
And all have to go through the same
process.
review process, same peer review. So, all right, thank you. Any other questions? I have one I'd like to, if there are no other questions from the panel. On the question of priorities, every one of these falls into the Enhanced Texas Research Capacity and Life Sciences Infrastructure. The work that they do, I would expect, would address other priorities that the Oversight Committee has established for CPRIT. And I'm not going to ask you at this moment to try to go into the work product of these different institutions, but I would like to just ask you to get back with me and explore what other priorities are being served by the investments in these core facilities, because I expect when you look at the graph that you prepared, you big tall stack on the right on Enhanced Texas Research Capacity and much smaller stacks across there, I expect that probably underrepresents the investment that these grants are making in some of these other priorities for us. And
Yeah.
I don't want you to get into the micro detail, but perhaps rare and intractable cancers, my guess is these facilities probably are doing some work in those areas. And so as we try to get a sense of our impact across our priorities, if you could go beyond or go behind just the research capacity and life sciences infrastructure and help us understand how those investments are helping us meet some of the other priorities.
Yes, indeed. And just a brief comment on that from that point. When you look across the previous year's awards to individual investigators and the like, the representation of specific projects that address priorities is quite high, as you have noted in the past. And it is these research cores that are supporting and underwriting that. So your point is exactly on target, that these are the core facilities that are supporting those other research projects, and
I
we'll do that.
expected that was the case, and I just want to make sure that in an effort to try to capture our impact across the priority areas,
Yep.
that on these core facilities we do examine that and show how they are contributing.
Yes.
Okay.
And just as another point, I think one of the things that we will do going forward is to make that part of our RFA request, so that the recipients of these awards are aware of how much we value the priority areas.
Thank you. Another, you note in the Texas Tech that this core has served 36 NCI funded programs, and you mentioned that it's helped them be competitive for NIH peer-reviewed funding. I think that's interesting information for us to be aware of, just to remind us of the leverage that comes from these kind of grants. And perhaps it's not a perfect fit for every one of the core facilities grants, but if you could tell us in each of these that, the Texas Tech one supported 36 NCI funded, the one at BCM supported 55 or whatever the number is, just to remind us and the public that watches this that these are really not isolated investments, but they are part of our nation's investment in the fight against cancer. So
Exactly. So just to make emphasis of your important point, the facility at Baylor, proteomics and metabolomics, supported 67 cancer investigators during the past grant periods. The MD Anderson Smithville, that served both Smithville, UT Austin, and Texas State, 28 faculty members were their work was supported. You've already identified the impact of the core facility from Texas Tech in North Texas. I'll add also, not only did that facility support NIH funding, but it enabled access to early phase clinical trials for people in North Texas, a program that is very important in terms of being competitive for industry-sponsored early phase trials to provide the academic infrastructure to do those trials in North Texas. This was a very important facility, and in fact was a key component of the UT Southwestern's ability to gain comprehensive cancer center status because of the outreach based on this core facility. Very specifically, it allowed UT Southwestern to take its discovery to impact on patients in Dallas rather than shipping it to St. Louis or to Chicago, because we were able to conduct those clinical trials with the kind of support that this core facility provided. So you pointed out really something quite critical to why this infrastructure support is so impacting, and thanks for pointing that out.
Well, in noting the number of researchers it supports certainly is important, but just to make sure that we've talked lately about the product development grants, and we've looked at the follow-on funding. So try to help the Oversight Committee and the state of Texas appreciate that these funds end up being leveraged by funds from elsewhere. Mm-hmm. And not only does that bring resources to Texas, but it's in many ways it's a third-party validator of the importance of our work. And the fact that it supports 67 different researchers, that's important, but it's really a different point than I'm trying to make with 36 NCAI-funded programs or NIH grants. Along the lines of what we were examining in the product development, just show that there are synergies here that are being supported by others. They're third-party validators, and they're putting their money behind these Texas programs. And NIH and NCI obviously well respected across the industry, and so if these are supportive of those, to me that's a little different. It's important that BCM supports 67 different researchers, but it's a different issue that the NCI and NIH money is following these grants. So to me that's a separate point, and one that it's important for us to be aware of.
Right. Yes, thank you. And again, Baylor Grant supported $50 million of new funds, and the Smithville facility, mm-hmm. I think it was $27 million. But your point, I think, is one that we will continue to pay close attention to. Mm-hmm.
And I think share is in our education efforts, both for mm-hmm. the panel and the general public, yep. to be aware of
yes.
that we're making significant contributions to initiatives that the rest of the country is also recognizing importance
yep.
and participating in.
Yep.
So, thanks. Any other questions? I beg your pardon?
He's going to do the recruitment now. The recruitment awards.
Okay.
Shall I go ahead with
the recruitment awards?
Yes.
Mm-hmm.
So this is very exciting to tell you about a 10 CPRIT nominations for CPRIT Scholars, and the first group is for established investigator support. This, of course, is for eminently established and recognized investigators in cancer research that would be brought to Texas. The three individuals that I'm going to tell you about are indeed really quite substantially representing the impact of this award. The first is Michael Clark, a physician scientist who is at Stanford being recruited to MD Anderson as an established investigator. Dr. Clark is a medical oncologist and is arguably one of the fathers of cancer stem cell biology. Cancer stem cells are different than the regenerative stem cells that we think about for our bone marrow or our GI tract, etc. They are the cells in cancers that sustain the cancer and to actually make it much more difficult to treat with conventional treatments, and has revolutionized our approach to cancer therapeutics. The second is Dr. Guomin Li. Dr. Li is a cancer biologist who is recognized as having made seminal contributions to the area of DNA mismatch repair. As you think about what happens in cells as they divide rapidly and have to replicate the complex DNA in the cell nucleus, there are chances for stochastic errors to be made just because of the numbers of times this has to happen. And the DNA repair system is essentially our cell's spell checker that corrects those stochastic errors. And it was Dr. Modrich at Duke and his colleague, Dr. Lee, who recognized the DNA mismatch repair mechanism and then showed that it was actually, when it was defective, was responsible for many important cancers, including colon cancer and uterine cancer. Dr. Modrich won the Nobel Prize last year for this discovery. Dr. Lee is at University of Southern California School of Medicine and is being recruited to UT Southwestern as an eminent or established investigator. And the third is Dr. Gail Eckert, another physician-scientist who's being recruited to UT Austin to lead the Livestrong Cancer Institute and to be the Associate Dean of Oncology at the Dell Medical School. Dr. Eckert is a renowned translational researcher whose expertise is in the design and implementation of early-phase clinical trials, and she brings a expertise that is, I think, critically complementary to the existing expertise at UT Austin in drug discovery and opportunity to build a clinically relevant preclinical testing program, as well as a program that can collaborate with the Austin community in bringing early phase clinical studies for cancer patients. The next is in the Rising Star category, Dr. Robert Jenk. Dr. Jenk is the third physician scientist that I'm presenting to you today. I think that in itself is a major statement in terms of impact of this mechanism. Dr. Jenk is currently at Memorial Sloan Kettering, and he's being recruited to MD Anderson as a physician scientist whose interest in stem cell in bone marrow transplant and stem cell transplantation, and how the host microbiome impacts on development of both tolerance as well as graft versus host disease. He has an R01 to study this area, and it's recognized as an increasingly critical area of investigation in terms of bone marrow transplant. And now I'll finish up quickly with 6 additional faculty recruits in the area of first-time tenure track. 1 to Texas Health Science Center Houston, 2 to UT Southwestern, 2 to MD Anderson, and 1 to UT Austin. And let me bring to your attention that the first 2 in this grouping, Xiao Shen Bai and David Taylor, are rated by our Scientific Review Council as 1s. Really quite a significant indication of the esteem that these young investigators are held by what they've done in their training programs. But the other aspect of this is that, as I mentioned earlier in discussion with Dr. Rosenfeld, they represent a new expertise that's recognized as really critical to cancer research as well as overall biology research in the area of cryo-EM. Cryo-electron microscopy is the technique that is replacing old structural biology efforts to look at the atomic level of how cells and proteins interact. And as I mentioned earlier, this is the critical discovery area for what drives our ability to do precision medicine. That is, we need to understand the molecular changes that occur in cancer. And so Dr. Bai brings computational expertise from the MRC in Cambridge to UT Southwestern's new cryo-EM research structure. And Dr. Taylor is a cancer biologist that will use cryo-EM to study critical aspects of gene editing. Dr. Akabe is from Dana-Farber Harvard Medical School, being recruited to UT Southwestern, focused her interest in lung cancer and how the immune system interacts with lung cancer. Point out that lung cancer, of course, is one of the diseases of importance to Texas, and she will bring new expertise to fighting this disease. Dr. Xin Yi is from Whitehead Institute at MIT, whose interest is in understanding the evolution of pre-malignant cells as they become invasive and metastatic, quite critical to our understanding of how to prevent cancer. And Dr. Wenbo Li is from the University of California, San Diego. He is studying non-coding RNA, and as Mr. Guerin and Dr. Rosenfeld recall, this is the area that Josh Mendel, when we were in Dallas, regaled us with the excitement that's developing in that area, and he will bring this expertise to UT Health Science Center at Houston. And Dr. Han Zhu is a computational biologist from Dana-Farber Cancer Institute, arguably one of the really top training programs for interface of computational biology and cancer research, and he's being recruited to MD Anderson Smithville. So in just sort of coming back to Mr. Guerin's point, among this group, we're talking about tremendous impact on new infrastructure for cancer research in the area of cryo-EM. We're talking about individual investigating lung cancer in terms of how the immune system is helping us combat that disease. We're talking about 2 computational biologists, and we're talking about an investigator who is bringing really cutting-edge fundamental research to understanding how pre-cancerous lesions develop and how we can actually attack that before the cancer develops.
Okay. Questions for Dr. Wilson? Dr. Rosenfeld?
Just a quick question. This is really an impressive group of people.
Yes.
I just happened to notice that 3 of the recruits were going to UT Austin, which I think is fantastic. And I was just wondering if there was a conscious effort to bring in investigators to a new medical school, or this just happened, or?
This is a concerted effort to take advantage of what is a unique point in time of cancer research investment and a campus that until a few years ago had not a focus in cancer, had plenty of potential. And so what we're seeing, just to your point, Dr. Rosenfeld, is not only today, but you may recall that earlier this year, this committee has supported 3 established investigator recruitments to UT Austin. They're already on site, and as well as several other first-time tenure tracks. So the answer is, I think, a very enthusiastic yes.
Let me clarify what
yeah.
I think I'm hearing. There is nothing in our approval process that puts the thumb on the scale in favor of UT Austin. They go through the same process. It just so happens that UT Austin has come forward with very competitive candidates, and they've gone through the peer review process just like every other institution, and they have done well and been chosen. Isn't that accurate?
Absolutely.
Okay.
Yes. Didn't mean to imply that there was any special favor, but
Right. Okay. I just want to make, when
absolutely.
Dr. Rosenfeld's question made it sound like, is CPRIT seeing this as an opportunity, and we're trying to help it? Not that there would be anything wrong with that, but that in fact is not the way we operate. They propose these candidates just like everybody else, and they happen to have competed well and were chosen through the same competitive process that any other institution in the state would go through.
Absolutely.
Okay,
And
thank you. I just wanted to clarify
Yes.
that we were not.
well, and so to explain my enthusiasm, and it is because I think one of the unique opportunities is illustrated here, and we visited Lubbock, El Paso, as Mr. Roberts mentioned, we're visiting College Station, and we're visiting Houston in the next couple of weeks. One of the messages that I think we're trying to provide is examples of how CPRIT mechanisms that we're talking about today have been used by the institutions over the past several years to build cancer research capacity. And so it's very exciting to see that happening outside of maybe the traditional suspects, if you will. And I think that's one of the really exciting things going forward for me, to figure out how to encourage that. But in the spirit of, just as you said, all have to be individually applied for, and also are critiqued by our review panel without CPRIT's engagement.
And let me add, let's not forget that last month you approved one in Tyler, and also with respect to UT Austin, these are not necessarily going to the Dell Medical School. UT Austin, as does A&M and several of the other institutions, have extraordinarily strong other departments that are related to life sciences research. I know we've done one of these in the Department of Pharmacy at UT Austin. So they may hold joint appointments, but in some cases, but not all, with the medical school.
Thank you.
Pete, thanks for the clarification. I didn't mean to apply any favoritism.
Well, favoritism is a negative sounding word, but I think it could have been heard as perhaps somehow we were in a partnership to develop those capabilities at one place relative to our involvement with another. So, if there are no other questions, I'd just like to ask you to turn to page 17 and summarize for the panel the research priorities that have been addressed by these grants.
The attachment one?
Page, yes, attachment
yes,
one. Yeah.
thank you.
Mm-hmm.
This is the Kristen Doyle chart, and at the heading,
It's the OC committee chart. How about that?
Thank you. This is the Oversight Committee chart. At the top, you'll see in pale yellow the academic program priorities, and you'll see in the bars represented the 14 that we've considered today. As I mentioned as we went through, all 14, and as Mr. Guerin re-emphasized, address the enhancement of Texas research capacity and life science infrastructure, quite obviously because of the core facility as well as the expertise that we discussed with respect to the recruits. I attempted to bring to your attention the individual recruits that address prevention and early detection, the two computational biologists, and the investigator from Dana-Farber who's coming to UT Southwestern to work with the lung cancer group in immune therapy. Mr. Garen's pointed out, I think quite astutely, that the core facility, as well as the other investigators, really do contribute to many of these other areas, but we have not parsed that, and we'll attempt to bring some real data to that in the future.
Okay. Any questions? All right, thank you. If there are no other questions for Dr. Wilson, thank you very much for your presentation and the very exciting slate of recommendations. I'd like to recognize Vince Burgess now, our Chief Compliance Officer, to provide the compliance certification report for all of the proposed awards.
Good morning, Mr. Garen, Oversight Committee members. The full compliance certification report is on page 33 of your proposed grant award booklet, and it was also made available to you in the OC portal. I've reviewed the compliance pedigrees for the grant applications that have been submitted for the 4 academic research slates that have been presented by Dr. Wilson. I've conferred with CPRIT staff and SRA staff, our contracted third-party grant administrator, and I have studied the supporting documentation, including third-party observer reports, our sign-out sheets, post-review statements, and I am satisfied that the peer review process followed applicable laws and agency administrative rules. I also attended the PIC meeting, the Program Integration Committee meeting, on September the 6th, and confirmed that the PIC review process complied with statute and administrative rules. Mr. Garen, I hereby certify these academic research award recommendations for the Oversight Committee's consideration.
Thanks, Mr. Burgess. Any questions of Mr. Burgess? Thank you for your thorough work. I'll now share the conflict of interest notifications. Mr. Angelou has reported a conflict of interest with the 2 University of Texas at Austin applications to be considered today. Is there any other conflict of interest declaration from any Oversight Committee member that has not been reported previously? Okay, hearing none. Members, you have the list of applications and grant amounts recommended by the PIC for the Academic Research Grant Awards. The PIC's recommendations will be approved if 2/3 of the Oversight Committee members present and able to vote approve the PIC's funding recommendations. Dr. Wilson presented 4 academic research award slates. Rather than taking up each recommendation individually, I'll ask for a vote to approve all the slates. If a member wants to consider one or more award recommendations individually, please make a motion to do so. We will take up the University of Texas at Austin recommendation first in order to accommodate the one conflict of interest that has been reported. I'll entertain a motion to approve the PIC's recommendations for a recruitment of established investigator award and a first-time tenure-track recruitment award to the University of Texas at Austin. Have a motion. Do I have a second?
Second.
All in favor, vote aye.
Aye.
Any opposed? Hearing none. The 2/3 of the members present and able to vote, the motion carries. I note for the record that Mr. Angelou did not vote on these recommendations. I will now entertain a motion to approve the PIC's recommendation for the Core Facilities Competitive Renewal Awards and the remaining recruitment of established investigator Rising Star and the first-time tenure-track recruitment awards.
So moved.
Have a motion?
Second.
Have a motion and a second. All in favor, vote aye.
Aye.
Any opposed? Hearing approval from at least 2/3 of the members present and able to vote, the motion carries. I will entertain a motion delegating contract negotiation authority to the CEO and CPRIT staff and to authorize the CEO to sign the contracts on behalf of CPRIT.
So moved.
Got a motion and a second. All in favor, vote aye. Any opposed, the motion carries.
Thank you, members.
The chair now recognizes, let me again commend Dr. Wilson for excellent work, and very excited about these initiatives and CPRIT's ability to participate and support them. Chair recognizes Mr. Roberts and Dr. Garcia to discuss FY 2017 program priorities.
Mr. Garen, we don't have any specific issues to bring to your attention. We had placed this on the agenda in case any of the Oversight Committee's members wanted to discuss this. We do see activity going on at the subcommittees, but absent any interest to continue by Oversight Committee members, the staff has nothing more to report.
Thank you. All right. At this time, the chair recognizes Ms. Martin to discuss internal audit reports over revenue and cash disbursements and the FY 2017 internal audit plan. After she completes her report, the Oversight Committee will move into closed session so that Ms. Martin may present the information security audit. Ms. Martin?
Good morning.
Thank you.
Good morning, committee members. We'll turn to section 4 in your package and start with 4-1. We have quite a bit of content to go through in this discussion. There are 3 internal audit reports, an internal audit plan, and our progress to date. So with that, if there are any questions as we move through, please let me know, but I'm going to move through relatively quickly. We have completed the internal audit plan for the fiscal year ended August 31st, 2016. So the internal audit plan is complete. All reports have been issued and are provided to you. There are multiple activities that have occurred in the last 60 days. And so we'll start with the revenue internal audit report. The revenue internal audit report is at 4-7 for your review. That audit was completed and the report was issued August 15th. And it has the overall report rating of strong. That's on page 4-12. 4-12 shows that we evaluated the process for administering revenue, both receipts of revenue as well as cash coming in, and monitoring the activities of bond proceeds. That assessment and the results of that assessment is at 4-15. And with that evaluation, we had two low risk findings. Low risk findings are those for which may have a deviation in their process, but don't cause concern or significance within the process itself or at the agency. And so those two low risk findings had appeared there in 2 of the sub processes, but you'll notice that we looked at the entire cycle of revenue, starting with the point in which bond receipts are validated, all the way through the funds received from appropriations. And so we really looked at all of the funding sources and identified sufficiency in controls across those cycles, and which is why the report has a strong rating. The 2 low risk findings have to do with continued monitoring of the potential for revenue sharing obligations and enhanced tracking of some of those obligations post the point in which the grantee is active, has an active grant award. So a different relationship that CPRIT has once there's not an active award. And then the second has to do with documentation that would be retained of the reconciliation of bond proceeds into the recorded records of CPRIT. That reconciliation we did identify was performed, just maintaining the documentation of that reconciliation. So those 2 are low risk findings. All of our controls that we identified tested without exception, and the results of our internal audit are that we have a strong overall assessment of the revenue process at CPRIT. Any comments or questions related to revenue? Looking back at my summary report at 4-1, I'd like to mention that we did perform an internal audit over information security. That audit was issued August 26th, and there were 11 total findings. We have plans to perform follow-up procedures in the fiscal 2017 internal audit year. Within that audit, we also were able to perform follow-up procedures over the 2 findings that remained from a previous internal audit over information technology. And so those findings have been combined with the information security audit. The next audit area is cash management, and we issued the report over our evaluation of the cash management and forecasting process on August 26th. If you'll turn to page 421, that's where the audit of cash management starts. And this audit also received a strong rating from our evaluation. On page 426 shows the strong rating, both from a design evaluation and the testing of the controls in that process. This particular audit primarily focused on cash forecasting and management of funds within the agency's responsibility. The sub-processes are on page 428, and we identified 13 controls across those 4 sub-processes. Those sub-processes were thoroughly evaluated, and we gained comfort in the design of those controls and all of the activity that we tested without exception. We had one low-risk finding, and that had to do with the performance of the cash forecasting workbook, which is conducted by our COO, and the executive director does review that, but we think that a more thorough documented review would be appropriate. So that's why it's a low-risk finding. All of the proceeds projected and received from issuance of commercial paper were tested and reconciled. And so that audit was what I would call a clean audit, and received a strong rating as well. Any questions or comments over the performance of those internal audit activities? If not, I'll move to page 4.2, which concludes the other activities we as internal audit performed for the fiscal year. Previously, I reported to you that we have a risk assessment, and we are working through that risk assessment as part of our 3-year internal audit plan. Annually, we will have a evaluation meeting with all the members of management and re-evaluate the accuracy of the risk assessment. Is it a current reflection of the risk environment? And so we performed that meeting on August 19th, and from that meeting we were able to make some modifications to the internal audit plan in order to, based on some of the learning that we had in the 2016 year. And so those changes are reflected in a revised internal audit plan that we're presenting to you today. Specifically, the changes are that in the 2017 internal audit plan that was previously presented, we had recommended that we perform an audit over non-grant expenditures. We recognize now that we've already performed an audit over non-grant expenditures, for which had a strong rating in 2015. We had the opportunity to evaluate revenue and cash management and test some expenditures through both of those audits in 2016. And it just doesn't make sense for internal audit to continue to look at an area that we've already evaluated and touched as strong. And so we were recommending replacing that internal audit focused area with an evaluation of the pre-award grant management process. So a piece of the grant management process, the pre-award portion, and move that up from the 2018 audit year to 2017 in order to really focus our resources on areas that warranted. That change then makes an opportunity for a new audit in 2018, and we are suggesting that audit be state reporting, and that would include all the reporting that goes from CPRIT to state recipients and use, including public reporting. We also had in 2018 a planned audit over budgeting and planning. But based on our review in revenue and in cash management and the cash forecasting process, we touched on the legislative appropriation request and on the commercial paper funding requests, and we feel like that area has been covered, and so we are recommending that we replace that internal audit area with the communications area, so that our recommendation to you is that the 2017 and 2018 plan that we as internal audit touch on areas that we've not looked at before, and that we're using our resources to focus on other areas across that risk assessment based on priority. The last item I have to, that internal audit report internal audit plan rather appears at page 4.3 for 2017 and 4.4 for 2018. So what's reflected there on 4.3 and 4.4 are the revised internal audit plans with those replacements that I just delineated. The last item I have for you is at 4.5, and that is our internal audit finding dashboard that we presented at the last Oversight Committee meeting. I'll just highlight some of the changes to this dashboard. At the top quadrant of the page, the second section, fiscal year 2016, all of those audits now say complete. And as you look across, we show the open findings, those findings that were able to be closed during the year. And then the final set of columns, there's total findings as of the end of fiscal 2016. You'll see that there were 5 findings in commodity and service contracts, for which we've already reported to the Oversight Committee. 2 low-risk findings in revenue, which we've reported today, and 1 low-risk finding in cash management that we've reported today. At the bottom of this page shows in total cumulative, from a tracking standpoint, any open findings that remain from internal audit activity. And at the very last line, you'll see that there are 10 from which internal audit will perform follow-up procedures in the fiscal 2017 year. Above that line are 5 for which management will communicate directly with the audit subcommittee the closure of those low-risk findings from prior audits. This is consistent with the discussion we had at the last Oversight Committee. The only change on this is the update of the reports that were completed since the last reporting. So with that, I conclude my planned remarks for internal audit status and update for the fiscal year ended 8/31/16 for CPRIT.
Thanks, Ms. Martin. I want to acknowledge the work of the Audit Committee under the leadership of Mr. Margot and working with Weaver on this plan. Any questions for Ms. Martin? All righty. At this time, the Oversight Committee will move into closed session to take up Agenda Item 8. Given the sensitive nature of the discussion about information security, and heaven knows recent items in the news have reinforced the importance of this matter, we're the security audit. We go into closed session pursuant to Texas Open Meetings Act 551.076 to discuss this security audit. The OC members will move into the ante room to discuss this, and the following CPRIT staff will join the Oversight Committee in the closed session: Ms. Martin, Ms. McConnell, Ms. Doyle, and Mr. Roberts. The time is 11:18.
All right, then it is 12:07. The board now reconvenes in open session. Members, is there a motion to approve the internal audit reports, revenue, cash management, and information security? So moved. Have a motion. Do I have a second? Second. Have a motion and a second. All in favor, vote aye. Aye. Any opposed? None opposed. Motion carries. Members, is there a motion to approve the amended FY 2017 internal audit plan? So moved. Motion and a second. All in favor, vote aye. Any opposed? Motion carries. Moving to the next agenda item is the final documentation and staff recommendations for the 2 FY 2017 service contracts.
Good afternoon, members. So with regard to under tab 5, I think that's right, my memo regarding the FY 2017 internal audit service contracts, that will be to implement the 2017 audit plan that you just approved with Weaver and Tidwell in an amount not to exceed $236,250. This is the second renewal of their contract. Do you have any questions?
Excellent job. I'm certainly clear about it.
Yes, good afternoon. My memo is right behind Heidi's, and we are requesting approval for a contract for an estimated $230,000 with the Austin Renaissance Hotel for the 2017 CPRIT Conference. As you can see there, the largest expenses with the hotel are food and beverage and audiovisual costs. These are estimates at this time. But we expect these estimates are the maximum. Once we look at things like menus, we will be able to, estimate that a bit better, but we will also have a per-person cost. So that cost will be variable depending on the number of people that attend. And as you know, food costs have to be covered by registration fees. The audiovisual costs are also estimated at this time. It is a maximum as well. As we finalize the program, those costs I anticipate will be a bit lower, but we're leaving some options in there if we want to film some of the keynote sessions. We did none of that last time. We did send out an RFP to Austin, Dallas, Houston, and we had a very limited response primarily because of the state rate that we need for room nights, and not a lot of hotels are interested in the state rates. But we are holding right now dates of November 13 through 15. As we talk about the program format, that might change a little bit. We might just have 2 dates. We're looking at options where we could maybe stretch it out, start in the afternoon, have a full day, and a morning the next day. So we're looking at options and trying to figure out which might be best, but we do have some flexibility. And so once the contract with the hotel is signed after your approval, then I will be able to estimate the rest of the costs and present a full picture budget to you in November for the conference. So, questions?
Yes, Mr. Montgomery, we're sure you would ask if there's going to be coffee.
There is quite a bit more food budgeted this time, so yes.
There's any questions? Is there a approved contract between Tidwell and the Austin Renaissance Hotel? So, got a motion, we have a second. All in favor, vote aye. Aye. Any opposed, motion carries. It's my understanding that Dr. Garcia, I'll thank you very much. It's my understanding there's no business to discuss for standing items 10, 11, and 12. There is no further business. The chair will move to adjourn this meeting. Got a second? Second. All in favor? Aye. Motion carries. The meeting stands adjourned at 12:12 p.m. Thank you.